The eyes are on the Jersey Shore. Today, I am in our Town Square Media Jersey Shore newsroom in Toms River, and I am with Dr. Ken Sable, the regional president, for Hackensack Meridian Health's Southern Market, which oversees Jersey Shore University Medical Center, Ocean Medical Center, and Southern Ocean Medical Center. And we're here to talk about COVID-19, and specifically with cases, vaccines, tests, where we are in terms of hospitalizations, how the hospitals here at the Jersey Shore for Hackensack have been doing of late, where we could end up, in a month from now through the summer as well, with the rate of transmission now below 1 at 0.92 as of here, April 21st. So Dr. Sable, thanks for taking out some time to discuss where things are at with the COVID pandemic as of the end of April here, early spring.
Well, thanks for having me, Vin. It's always good to be with you, and I hope you and your family are staying safe. It's amazing that we're already, a year and a month into this pandemic. And while we've made a lot of progress, and really a ton of progress, I think it's important that everybody understands we're not out of the woods yet. We may not be completely out of the woods for quite some time, but we are absolutely making progress. And I think that the advent of the vaccines and having, the mRNA vaccines available, getting our mega sites up in the state, and trying to get as many people vaccinated as possible is really going to help us to get on our way to hopefully getting back to quote unquote normal, or the new normal.
And I think certainly everybody wants to see that normal, whatever the new normal looks like, sooner than later. Certainly trends are, for the most part, heading in a positive direction, certainly better than what it was a month ago. Rate of transmission about 0.92,
yep,
under 1, which is certainly a good thing. And the lower we get with that number, the better. So how have the hospitals at the shore been doing, certainly more recently in April and March and everything, in terms of the amount of patients,
sure,
and people testing positive for COVID, the amount of people being treated for COVID-19 and then getting released, and with a clean bill of health?
Yeah. So, it's interesting. We have seen kind of a wave pattern. After December, January, and the holidays, we had seen some decreases for a period of time. But after the holidays, starting in mid to late January, and certainly February and March, we started to see the numbers creep back up significantly. In many of our hospitals, we were down significantly in numbers of patients. And those numbers actually have doubled in the past month or two. The good news is that in the past probably week or two, we have seen a somewhat steady decline across the southern market. Jersey Shore, Southern Ocean, and Ocean Medical Center, as of Monday, we have about 117 patients in the hospital that have COVID positive. Some are in the ICU, some are on the medical floor. But that's down significantly from some of the numbers that we were seeing a few months ago. We're definitely making progress. We've discharged about 5,000 COVID patients from those our 3 hospitals. We've taken about 300 patients off of ventilators, and just in our 3 hospitals alone, we've done almost 100,000 vaccinations that have been administered. So again, I think we're making significant progress. But again, we can never let our guard down.
In terms of COVID cases, have you had any issues lately, or even this year, in terms of having too many patients come in, or trying to find enough beds and supplies and people to treat these patients coming in with COVID-19?
So, one of the things that's a big difference from the initial wave 1 back a year ago was that at that time we shut down all elective surgeries, if you remember.
Right.
So the only thing really functioning in the hospital were the emergency departments, and of course the inpatient units where we were focused on taking care of COVID patients. So we're in large part back to normal in terms of operations, in terms of elective procedures and so forth. And so when you add in the volume, the normal volume coming to the hospital, plus the COVID volume, we actually have significant volume and census numbers in our 3 hospitals. Southern Ocean Medical Center had upwards of 140 something patients in the hospital. Jersey Shore has approached 600 patients in the hospital. which is significant compared to what we would normally budget for this time of year. So we're seeing, and if you take out the the 65 patients at Jersey Shore, 33 COVID at Ocean, and 19 at Southern Ocean as of Monday, you can see Jersey Shore's volume would normally be in the low 500s, not approaching 600, for example.
Now, in terms of vaccine, certainly more people getting vaccinated by the day, by the week, and everything. What is the current status of vaccines being given out through Hackensack Meridian Health at the hospitals or elsewhere in the region?
So, we continue to maintain that getting vaccinated, providing the vaccine to the majority of New Jersey residents and of course the country remains the best way to beat COVID-19. So we are, aggressively trying to get our hands around product and having as much vaccine as we can to be able to distribute in our various vaccine villages and our mega site up in Bergen County. We want to reassure the public that the vaccines are safe. The mRNA vaccines are short-lived in your body, but what's in that vaccine is just the instructions or the recipe to make the spike protein, which your body's natural immune system can then make antibodies to. We are aware, obviously, of what's going on with the J&J vaccine. We do anticipate that the J&J vaccine will go back into circulation soon. And I think it's interesting that the fact that we identified this safety issue with this vaccine should give people reassurance that the system works. To be able to find a needle in a haystack and a complication, as we found, shows you that the quality control mechanisms around these vaccines is functioning properly. One of the things I think it's really important is, we need to achieve either through herd immunity for people who've had the vaccine already, people who've had COVID already, plus people getting vaccinated. The combination of that, the more we can maximize that, obviously through vaccination, not more and more people getting COVID,
right?
The closer that we'll get to being able to get back to normal. And I know you want to talk about, opening things up, and that's going to be a big driver of that.
I want to hit on one point that you did touch on in terms of the vaccine, just because it is important. There are a lot of people skeptical, certainly with the news of the Johnson & Johnson vaccine, which isn't as effective as Moderna or Pfizer to begin with. But just with overall vaccines, a lot of people pointing to that it's emergency use, it's not regulated and everything, but there's a lot of people still questioning, I guess, the science behind it, the medical reasons behind it, and then just people getting vaccinated for all different kinds of reasons here. But with everything you know about each and every one of the vaccines, what's involved, what side effects are involved, because that's a big concern for people too. Not just the initial side effects you feel of, fever, chills, headache, similar stuff to COVID itself, but other people are reacting in other ways, perhaps, whether or not it's from an underlying condition or not. I know the CDC certainly investigating the Johnson & Johnson here, but again, to circle back to the point here, how safe are all these vaccines? Is there one that's a preferred one, or a vaccine that's a little bit more safer and less of a side effect, or a vaccine that will last longer? Is it Moderna? Is it Pfizer? Where do we stand right now in terms of the most effective vaccine and the least amount of side effects?
So, let me just say that we believe that all vaccines are good choices. And we're not really trying to pit one against the other or one that's inferior. Even as you mentioned with the J&J study, it wasn't apples to apples in terms of how that study was done. And many people feel that that vaccine is actually, just as effective. Most importantly is even with the J&J vaccine, it prevented 100% of hospitalizations and deaths due to COVID. So, even if you want to say it's less effective in terms of preventing you from getting COVID, it was still 100% effective in preventing you from, being hospitalized or dying from COVID, which is really what we're trying to do with the vaccine, right? We're trying to prevent, significant morbidity and mortality. With that said, I was one of the ones initially that would say, you know what, I don't know enough about the vaccines. I can't say that I want to be the first one in line. But then we started to get the science and we started to understand how these vaccines work, and understanding that this is not a live attenuated or a live virus. So nobody's injecting virus into you. The actual material that goes in terms of mRNA, for example, or the adenoviruses are short-lived in your system. In the case of mRNA, it's the recipe for making that spike protein so that your body's natural immune system can take over. What we still don't know yet, to some degree, is how long the vaccines will last. Will we require a booster shot, for example, in the fall? We don't know that yet. We also don't know exactly how effective the vaccines will end up being against the new variants, although preliminary data is saying that they are quite effective. So, to your point about side effects, I think that, the message that I like to say and give out to people is, regardless of the side effects of headache and fever and rigors and really feeling lousy, general malaise for a day or two, they're far better than the side effects of COVID itself in general, as well as the potential consequences of getting COVID and what could happen, if you end up getting more sick from COVID. And some people get sick and we don't know why. So I would say that, all in all, the vaccine is much safer, and I highly recommend, a vaccine, not necessarily a specific vaccine.
Now, Governor Murphy has repeated a point all along that 70% of the adult population is the goal to get people vaccinated in New Jersey. Beyond what data and science he's actually using is a debate, certainly for another show and for a lot of other people there. So, but to get there, if we get there soon, and if it's within the next month, based on what you know about the vaccine, based on what you know about the virus and everything, can we get to a full state reopening and lifting of restrictions so that going to the beach, going to the store, going to church, going wherever won't be, I guess, as much of a process in getting ready and making sure that you're wearing a mask, being socially distant, and doing all sorts of things to prevent spread?
Well, I think that the goal of 70% is a great goal. I can tell you from being on the inside, we're really working hard to working with the state, with the Department of Health, with New Jersey Hospital Association to ensure, adequate supply of vaccine. And I can tell you it's sometimes on a week-to-week basis where, we have good supply coming this week, or we don't have good supply coming. And so that's a little bit of a challenge. If we have the product, we can get it into arms efficiently, effectively, and satisfactorily to the communities. In New Jersey, we've done probably about 6 million or so vaccines already. Hackensack Meridian Health, we've done almost 500,000 vaccines alone. So we have the capacity to do it. We just need to be able to get the product. So that's one bottleneck I think that's going to be important. And you've probably heard covering the media all the challenges that people have had, particularly the elderly, in getting appointments. I've heard from all of my parents, friends, relatives, and others, as have all of the executives in hospitals. How can you help get us in? So we've made a lot of progress on that in terms of our appointment systems, in terms of getting enough product and getting the message out that anybody who wants a vaccine, we want to be able to accommodate that. So we're each week we get better, not only at HMH in terms of our vaccine distribution, but also in terms of the state. And I think we're on our way to being able to achieve that 70%. As to your other question, I think it's vitally important that we all continue to keep our guard up, continuing to follow CDC guidelines, frequent hand washing, wearing a mask, adhering to the indoor capacity limits, even if you get the vaccine. I think that we will have to see how many people actually get vaccinated. And, there's a lot of models that say if we can achieve, the desired vaccine levels, as well as the number of people who've had COVID, that potentially by June or July, we could achieve, close to herd immunity. And then and only then will we be able to start, even thinking about relaxing some of the protections that are in place today. But until we're really convinced of that, I don't think that we're ready to do that quite yet.
With not a lot of doses, especially coming into Monmouth and Ocean counties. In fact, within the last couple months, there were 400 doses taken away from Ocean County by the state. Is there concern among the hospitals and among the vaccine sites across the Jersey Shore here with people having to wait now for with the news of Johnson & Johnson vaccine is delayed, of people trying to get vaccinated and then trying to prevent spread at the same time, and waiting sometimes days, weeks, or even months to be able to get vaccinated? Is that a big concern or a big issue at the Jersey Shore right now?
Well, I think it is, in the sense that, the sooner we can establish, herd immunity via those two methods I just talked about, the sooner we can begin having the conversations about truly getting back to normal. And if we're not able to have all of the tools available to us, i.e. J&J vaccine, I mean, that was a big part of our strategy and remains a big part of our strategy, particularly because of its convenience with one dose, and because of the fact that it doesn't require ultra cold chain refrigeration, particularly like the Pfizer does. That the J&J vaccine was going to be, a big part of us being able to get out to some of our communities and, be able to use some of our other assets and locations to be able to distribute the vaccine. So, we're obviously looking forward to getting back to being able to use and incorporate J&J into our tool set. But in the interim, it's really going to depend on how much product we can get by Pfizer, Moderna. I know AstraZeneca's, had some potential challenges as well. But we're continuing to modify our plans to secure as much vaccine as we can and to give it out and get it into arms as soon as possible.
What are some of the recommendations, maybe sticking? I mean, a lot of the health advice seems simple, at least as it piles up here. But what are the ways that, whether you've been fully vaccinated or half vaccinated or still waiting to get vaccinated, ways to prevent spread of COVID or just general spread of germs, anything that people should be doing at home, at their office, when they're going out and about, to just stay as healthy as possible until collectively as a state, we do reach that point where a lot of people are vaccinated or we hit herd immunity and things can go to whatever normal lies ahead.
Yeah, I'll reiterate again, keep your guard up, follow the CDC guidelines. Washing your hands, wearing a mask are the two mainstays of protection. Adhering to indoor capacity limits. I have some optimism that we're approaching warmer weather. We saw last summer, a significant decrease as more and more people were able to get outside. And I think if you do those things, you'll at least protect yourself. And it only takes one. It only takes one lapse. When I ask people who've had it, how did you get it? It's always, I let my guard down for 2 minutes. I was around this person. We weren't wearing masks, and I let my guard down. And that is probably the moral of the story. One of the things I do want to make sure people hear is that one of our greatest concerns now, and that we're hearing, is that the community is not resuming their wellness checks with their doctors, receiving preventative screenings. And, I was just speaking to somebody recently about the incidence of cancer has gone way down. And I say to them, it's not that the incidence of cancer has gone way down. It's that the incidence of diagnosed cancer has gone way down. People who have put off their mammograms, their prostate exams, their colon, endoscopy and colonoscopies, all of that preventative screening that people are not doing is very concerning, because wellness checks and preventive screenings can help detect signs of illness and chronic conditions before they become serious symptoms. So it's really important that we get that message out to our communities. Go back to your doctor, have your screening exams done, because when we find illness early, it's much more treatable than when we find it later.
Dr. Sable, before we wrap up, is there any other points that you wanted to hit on to just bring attention to testing or vaccines or anything about where we're at with battling this coronavirus here at the Jersey Shore?
Sure. In summary, I would say we're not out of the woods yet. We are making progress. Keep your guard up, wash your hands, wear a mask. Don't neglect your own health and make sure you get your preventative screenings so that we can ensure we keep our communities as safe as possible. And get your vaccine. And get your vaccine.
Yes.
Of course.
Get
your vaccine. That's I should end with that. Get your vaccine. It's safe, and it's going to get us back to normal sooner than later.
I think that sounds good to everybody. Some semblance of normal, of going places. The day I think people are looking forward to not having to wear the mask and being able to have the feeling that when you go somewhere and drive somewhere, you don't have to worry about catching coronavirus.
Absolutely. And it's interesting that we had a very low flu season this year. And it's really because when you wear a mask, you prevent a lot of these respiratory viruses and illnesses like flu and the typical common cold. So that's an interesting byproduct of that. Not shaking hands and wearing a mask can prevent so many common colds and viruses that maybe those are some practices we should keep for a while.
I think that's one of the things that you and I discussed earlier this year or last year. Maybe the handshaking thing or the high fives and hugs, maybe at least to an extent that will become a thing of the past. We'll have to find new ways to say congratulations and hi. Yeah, the elbow
bumps,
the air five.
Yep, everything's good. Yep.
Dr. Sable, thanks for taking out some time to discuss where we're at the hospitals and within Hackensack Meridian Health, and just kind of generally at the Jersey Shore and beyond here, with testing, with vaccines, kind of where we're at with the pandemic, and trying to push a little bit each day to getting to that new normal, whatever anybody wants to call it out there, to the day where coronavirus is a thing that's behind us, and certainly something to learn from moving forward.
It's my pleasure, and thanks for having me on, Vin.
That is Dr. Ken Sable, the regional president for Hackensack Meridian Health's Southern Market, which oversees Jersey Shore University Medical Center, Ocean Medical Center, and Southern Ocean Medical Center, talking about the COVID-19 pandemic, where we are at with testing, with vaccines, where we could end up in the coming weeks and months, and reminders of what we should all be doing with wearing masks, being socially distant, trying to do the best we can to prevent spread of germs. And if you're sick, stay home, get better, and take on what you got to take on outdoors another day. Once again, for Dr. Ken Sable, I am Vin Ebenau here in the Town Square Media Jersey Shore newsroom saying stay safe, stay well, and we'll talk to you soon.